Have you ever wondered what really happens behind the scenes during a C-section, beyond what the doctors explain? What about the part no one talks about, the unexpected physical, emotional, and mental experiences? If you're new here, be sure to subscribe for more educational videos on pregnancy, childbirth, and postpartum recovery. Now, let's get into what no one tells you about having a cesarean section. 1. It's major abdominal surgery. Most people know that a C-section involves surgery, but many don't fully realize just how major it is. Unlike other surgeries, a cesarean involves cutting through multiple layers of tissue, including skin, fat, abdominal muscles, and the uterus, to safely deliver the baby. It's a complex process that requires a sterile environment, anesthesia, and careful stitching afterward. What makes it unique is that the patient is usually awake during the procedure, experiencing everything in real time. This can be both reassuring and overwhelming. You may feel pressure, pulling, or tugging as the baby is brought out, which can feel very strange if you're expecting numbness to mean a total lack of sensation. Post-surgery, your body will need time to heal not just on the surface, but internally as well. Healing a uterine incision is not like healing a cut on your skin. It involves deeper tissues, and in most cases, full recovery takes at least 6 to 8 weeks, sometimes longer. Because it's often treated as a routine procedure, many moms are caught off guard by the intensity of the physical recovery required. It's important to approach it with the same level of care and caution as any major surgery. 2. You might feel disconnected from the birth experience. A common yet rarely discussed emotional response to a C-section is the feeling of disconnection from the birth experience. Especially if you are hoping for a vaginal delivery, having a C-section, whether planned or emergency, can leave you feeling like you missed out on something deeply personal. During a C-section, you may not be the first to hold your baby, or you might be groggy or shaking from the anesthesia. This can interfere with that immediate bonding moment many mothers anticipate. Some women describe feeling like bystanders during their own child's birth. It's also possible that the sterile environment, the drapes, the operating table, and the clinical setup make the experience feel more medical than emotional. You might feel rushed or under pressure, especially if complications arise. These emotional responses are valid and deserve acknowledgement. It's important to talk about them, seek support, and know that bonding with your baby can still be strong and beautiful, even if it doesn't begin exactly as expected. 3. Recovery can be more restrictive than you think. Unlike a vaginal birth, which often allows for quicker mobility, a C-section recovery is typically slower and more restrictive. For the first few days, you may need help simply getting out of bed or walking to the bathroom. Lifting your baby, standing up straight, or climbing stairs may feel like a major effort. There are also specific precautions you must follow. No heavy lifting, no strenuous activity, and no driving for at least a couple of weeks, or until your healthcare provider clears you. These restrictions can make it difficult to care for your newborn, especially if you don't have much help. Pain management also becomes part of your routine. Prescription medications might be needed in the early days, but even over-the-counter options can bring side effects like constipation or drowsiness. Balancing pain relief with being alert for your baby can be tricky. You'll need to listen to your body, rest when you can, and avoid pushing yourself too soon. Full recovery is a process, and giving yourself grace during this time is essential. 4. Your belly may feel numb or weird for a while. Another thing that surprises many mothers is the strange sensation, or lack thereof, around the incision site. It's common to experience numbness, tingling, or even sharp, fleeting nerve pain in the weeks or months after surgery. This is because nerves are cut during the procedure, and they take time to regenerate. For some women, the numbness fades within weeks, but for others, it may linger for months or even become a permanent change in sensation. These feelings can be disorienting. Some mothers report a disconnect between touching their belly and actually feeling it. This can interfere with your sense of body image and comfort in your postpartum skin. Massaging the area, wearing supportive garments, and following your doctor's guidance can help you cope with these changes. But understanding that they're normal and common is the first step in managing your expectations and reducing anxiety. 5. The emotional aftermath can be unexpected. While the physical recovery from a C-section is often emphasized, the emotional journey deserves equal attention. Some mothers feel empowered and grateful for the procedure that brought their baby safely into the world. Others may feel sadness, guilt, or even grief, especially if the C-section was unplanned. Postpartum depression and anxiety are not uncommon after any birth, but C-section moms may face additional emotional hurdles. The feeling of being robbed of a natural birth, the trauma of an emergency procedure, or the frustration of a slow recovery can all contribute to emotional distress. It's important to know that these feelings are valid. Talking to a mental health professional, joining postpartum support groups, or simply opening up to trusted friends or family members can help you process your emotions in a healthy way. There's no one-size-fits-all response to childbirth. Acknowledging your feelings, whatever they are, is part of the healing process, physically and emotionally.